Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest in the show, just head on over to missionmatters.com and click on Be Our Guest to Apply. All right, so today is a very special episode. We have Jan Hines on the line. She's a senior officer, strategic engagement over at Action Against Hunger. Jan, welcome to the show.
Thank you. So happy to be here.
All right, so I've been waiting to get you on the show for a long time. It's grateful to have you here today to get into what you're doing over at Action Against Hunger. But before we get into that, we'll start this episode the way that we start them all, with what we like to call our Mission Matters Minute. So, Jan, at Mission Matters, our aim and our goal is to amplify stories for entrepreneurs, for executives, and for organizations. That's what we do. Jan, what mission matters to you?
Yes, thank you so much. So really my mission is to inspire and activate people to use their time, their treasure, and their talent to advance humanity forward. When we think about our lives in the developing world, in many ways, we've really hit the geographical lottery. And I am passionate about helping people kind of match what their interest is, what their passion is, what their, gift is to better humanity in a really meaningful way. And I'm so grateful for the opportunity to talk about Action Against Hunger and what we're doing to move humanity forward there.
It's amazing. Great to have you on, Jan. And what a big initiative Action Against Hunger is, just helping at scale and the scope. So we'll get into that because I definitely want to hear some numbers and just the size, because as I was doing some research, it's just amazing the work that's being done. But for you personally, did you know early on that you wanted to get into this type of work, or like the humanitarian side and helping the world, really? I mean, that's the scope of this business.
Yeah. Interestingly, I was always drawn towards the nonprofit field. Right after college, I started working for the Christopher Reeve Paralysis Foundation and spinal cord injury. I worked in the field of organ donation and transplant for 17 years. Wow. I dabbled in corporate for a bit, but I really missed the purpose-driven work that I had in my other careers. So I actually sought out
that pull, right? Like it was that pull.
I had that pull, and I really felt like I was kind of wasting my time and talent in corporate because I felt so strongly about going back to something that was really mission driven. So I started researching NGOs globally and found Action Against Hunger in their New York office and just applied on the website. So I knew what I wanted to do, and I just started researching until I found the right place to work for.
It's so interesting to me. I feel like I use the word calling. Like, I think when somebody's walking in their calling or their path or something, when they try to do other things, it's not that they, do bad in corporate or other things. I don't mean anything particular industry or otherwise. I just mean like when somebody's following their path or their calling, like it pulls them, and it's like anytime I've tried in the last 10 years, I'm not even joking, Jan, to think about something other than podcasting, it just feels weird. I don't know. It feels like I'm wearing somebody else's clothes, if that makes sense.
Yeah, it totally does. It totally does.
Well, let's start with Action Against Hunger. Maybe just talk, for those that haven't heard about the organization, maybe just talk a little bit about the organization, the scope, the mission. Get into some of that, please.
Sure. Yeah, I would love to. So we've actually been around for 45 years. The organization started in France, and it was a group of physicians and academics and scientists that came together to develop the first therapeutic food, which was called F100, a milk formula treating malnutrition. So it has then since spread. We now work in over 55 countries, and our primary focus is, of course, about hunger, but it goes so much more deep than that. Our primary focus is really about prevention, treating malnutrition. We spend a lot of time focused on those first 1,000 days. I'm not sure if you've heard about this really important time frame. It's a time frame from conception to 2 years old, and that's a critical window for nutrition and development throughout an entire lifespan. So we focus on early detection of malnutrition, developing these therapeutic foods that provide essential nutrition in areas of that lack resources. And then a lot of our work is actually around water and healthcare services. So we have a holistic approach to make sure that every area is met, and we work in the most under-resourced areas in the world.
Can you give me? I know you travel quite a bit, and I believe you're just in Africa. Can you, when you say under, privileged and maybe lacking areas that you're helping, can you give us like some ideas around that, please?
Sure, sure. Yeah, and if it's okay, I'd love to just share what got me into the interest of global development because it all ties in together.
Absolutely,
So
please.
the quick story here is how did I end up in global development, right? I grew up in New Jersey. I had a pretty normal
And
tradition.
hold on, wait a minute. You got it? Didn't you get a little? Chirag told me, I think you got a promotion or something recently. I'm sorry, I had to cut you off. Didn't
Oh,
you?
no, that's okay. Yes.
Congratulations.
Oh, thank you very much. Thank you very much. Yeah, so I've been with Action Against Hunger for a little over 2 years. Recently got a promotion, doing more of the, strategic engagement that you
Yeah.
introduced me with that title just a few minutes ago.
Hmm.
And, I guess just to briefly share with you what brought me here.
Hmm.
So I started traveling on a volunteer basis when I was in high school. So I did my first trip, a teaching program in Russia in 1997. I did some clean water trips, building wells. And, I started to see that the reality that I had in New Jersey was very different than the reality that many people around the world faced.
Mm.
And when it really came to a turning point for me, when I could no longer deny the pull that you talked about, right?
Yeah.
Of cognition
Yeah.
is, my daughter, who's now 6, was born with a congenital heart defect that required open
Mm.
heart surgery as a baby. And she was able to have that surgery at Columbia in New York City. She's amazing, healthy, thriving, loving life, doing
Yeah.
great. And after her surgery, I decided to start a fundraiser for cardiac surgery in the developing world. Fast forward 5 years. We raised about $350,000 for cardiac surgery, and I started traveling with that medical team to
Mm.
areas like Peru, Mexico, Guatemala, and realizing that these children had no access to doctors, no access to
Wow.
life-saving surgery until this international team of doctors and nurses, came and in 1 week would do like 30 surgeries of these critically ill children. And I
Mm.
started to really think about, my children are no more deserving of healthy food, clean water, medical care than these children. And that's when I decided I need to find an organization that is doing this work and I need to join it and I need to, amplify that message because
Mm.
every child deserves a chance at life, right? Our
Yeah.
CEO is actually from Ghana in Africa. And he always shares this really important sentiment that potential is evenly distributed, opportunity is not.
Mm.
And he says that because he grew up poor, farming family in Africa. He was only able to go to school because of a government sponsored program that provided free education. He then got a scholarship to Purdue University. He has a PhD in agriculture. And even though he had this amazing opportunity to come to the US and have this education, he could have kept a, cushy corporate life. He
Right.
decided to go back and work in these developing areas, many within Africa and Asia and other places to teach sustainable farming, to bring clean water, to bring access to medical care. So,
Mm.
that's a little bit of how I got into this work. What really drew me
Mm.
to the international field was just, we have no idea the lack that these areas
Yeah,
have and how easy it is. I don't want to say easy to minimize it, but how with a small amount of investment,
for sure.
great
Like it's solvable.
lives can
That's the
be,
thing. It's
it's
solvable.
solvable. It's solvable. So
Yeah.
you asked me about my trip to Africa,
Mhm.
and I just got back from
Hold
Africa
on,
last.
before Africa, I need that saying one more time. Potential is evenly distributed. What was the second part?
Potential is evenly distributed. Opportunity is not.
That's going on Twitter later. I love
Yes.
this. This is
Yeah.
my
It's
like I've been
so.
pulling like one of these things, and the gentleman's name, the CEO that's it's
Oh, yes.
attributed to.
Dr. Charles Awuba is our
All right.
CEO from our New
I'm
York.
gonna, I'm gonna call I'm gonna call him Dr. C or Dr. Charles on Twitter
Sure. Yep. Yep. That's
today.
great. But
Potential is evenly distributed. Opportunity is not. I'm gonna take that with me. That's amazing. Please.
please do. Please do.
Mhm.
Because when I heard that, it really transformed the way I think about the world.
Yeah, it's hitting
We,
me right now. Like
yeah,
seriously, it's amazing.
we take for granted the fact that we have a grocery store on every corner,
Mm.
in most cases, or that we have
Yeah.
CVS or pharmacies or even drivable roads, electricity, internet. The list
Mm.
goes on and on. And when you go to the areas like I was in last week in Africa,
Mhm.
we have a team in Nairobi, and we visited very remote tribal communities
Mm.
where these mothers that I met, they want the same things for their children that I want for mine, right?
Absolutely.
They want a healthy future. They want opportunity. They want
Mm.
education. And we visited, we're developing new programs where we're going to be funding school lunches. And we
Mm.
visited schools where these children, they don't eat for the whole day that they're in school.
Wow.
And the teacher that we met with in this one rural community said, if there's no food, students will not come to school. Oftentimes that one meal, even if it's something as simple as a porridge or some rice
Yeah.
and cabbage, is what brings them into school for the day to get an education.
Mhm.
So again, something that would be a few $1,000s for us to fund a school lunch program
Mhm.
transforms the access to education for these students. So it's really remarkable to see. And I'll lastly just share with you that when I was again in Africa, visiting these tribal communities, where we
Mhm.
would often drive 4 hours each way, and really not on roads, just kind of dirt paths. It's kind of like
Yeah.
what you would see on a land cruiser commercial, the types of roads that we were on. These communities had no access to clean water. They were walking for water hours, which of course many of us have heard about the plight of walking for water. That's
Mhm.
not even clean. And the kids were sick. They weren't able to go to school. And then just a few miles down the road, we
Mm.
visited a community where we had been able to bring in a water system, and it was night and day. Right? Their
Wow.
gardens were flourishing. Their children were healthy. They were clean. They were able to wash their hands. These basic things that, are
Mhm.
so simple and a basic right for all humans. We were able to make possible. And I
Mhm.
can't tell you what a difference we felt in that community versus the one just a few miles away, that lacked that clean water.
Mm. And I know this is pretty timely on our end, and the kind of warming up for this when we were prior to this. I want to go further into what we started to talk about before we had
Mhm.
to go live. Right now in the Philippines, like you're reaching out,
Yes.
very timely for everybody that's watching this. So we're streaming this on June 16th, 2026. So give us like kind of like real time what that looks like, because we happen to be in the middle of something where resources are being deployed.
Yes. Yeah. No, thank you for bringing that up. So, like I said, part of what Action Against Hunger does is teaching that sustainable farming, developing these school lunch programs, bringing clean water, bringing healthcare. But another major component of our work is disaster relief and
Mm.
response. So we respond to 50 to 75 disasters annually within 24 to 48
At
hours.
50 to 70, what, I didn't catch that. What, how many?
Well, depending on what's happening, but
Depends.
between 50 and 75 disasters throughout the world.
Wow,
And
that's a lot. That's why I wanted to highlight that. That's
yeah,
a lot. That's like one a week plus if we're doing the
exactly.
average. That's a lot. Go
Yeah.
ahead, please.
And so, like I mentioned before, we work in over 55 countries, and 95% of our staff are born and raised in the countries in which we
Mm,
work. So
mm,
that gives us a unique opportunity to respond anywhere in the world within 24 hours when there's a natural disaster. So we were just chatting before that we have a team stationed in the Philippines that's
mhm,
responding right now. A lot of that response is around restoring clean water systems. So when
mm,
there's a natural disaster, of course, one of the major issues is a lack of clean water, which
mhm,
not only do people need to live, but also can breed disease if it's not dealt with effectively quickly. So a big part of our work is coming in with systems to purify the water, but
yeah,
also cash vouchers, a number of different things that families might need. It could be something as simple as bedding, pots and pans,
mm.
food assistance. So we are live on the ground in the Philippines right now, responding to the disaster that's happening.
Hmm. Can you talk a little bit about just shifting focus here slightly, because I know the organization does a lot, but I'm curious about some of the work that you're doing along women empowerment, why this has been a focus, and why it's so important in like these specific communities where
Yeah.
maybe it was overlooked in the past.
Yeah, no, absolutely. So a lot of our work is around women's empowerment, and part of that is teaching basic trades that women can then bring their,
Mm,
trade to the marketplace to get some money for their families. So in a lot of the areas that we work, they're very remote, they're very hard to reach. So I'll just
mhm.
go back to the example of Africa because it's top of mind since like I
Yeah.
said, I was there last week. The main income for the families that we work with are they're herders, they're pastoralists that are out in the fields with animals all day. So in
Mm,
the communities that we visited, the men were essentially gone many times for weeks, if not months on end.
mhm,
And the women were really the ones taking care of the household, growing the vegetables, taking care
mm,
of the children. So what
yeah,
we do is often empower these women with something as simple as a goat, rabbits, chickens, where then they can use those animals for nutrition, but
yeah.
also selling the milk. We also teach trades like in the one of the tribal villages that we visited, the women made beaded jewelry that then they're able to bring to the marketplace for some
Mm,
income. And another really important factor when it comes to gender and women is our WASH programs, which is water, sanitation, and hygiene,
mhm,
because a big part of our work is building latrines and bathrooms in schools. So
mhm,
you can imagine for students, especially for girls, when they hit puberty, oftentimes they drop out of school, they miss a lot of school because they're not able to go to school in a dignified way, when they reach the age of whatever it is, 12 or 13 years old. So building bathrooms in schools, believe it or
mm,
not, transforms girls' access to education. We also educate boys and girls about menstrual health and teaching them how to actually make reusable sanitary products that keep girls
mm.
in school, keep them educated, and keep them on a path to a healthy and a vibrant future. So those are a few of the examples of how we work with women empowerment, a lot
Mhm.
around teaching those trades, access to health and hygiene, and the last thing I'll mention that's really important. I was also in Guatemala a few weeks ago, and we do very
You
similar.
travel a lot, huh? How
I,
often are you on the road? I gotta know. Sorry to
no,
cut you off.
no, that's okay. I would say I try to go every few months when I can, and part of what I do is bring, whether it be some of our board members or
Of
my
course.
advisory council, because it's so important for them to see the work and understand the impact of what
And you
they're
got
doing.
to be boots on the ground because if not, you get detached from the work. And I'm asking, by the way, that
Yes.
wasn't because it seems to me I've never done this particular type of work, but if you're not seeing it, feeling it, meeting the people on some level at some frequency, then it can get disconnected. It seems like. Am I
Yeah.
off on that? Like, is that something that's culturally kind of woven into this?
Yeah, whenever we can, we always want to be able to share those stories
Hmm.
about the people that we're able to impact. So,
Yeah.
when I was in Guatemala a few a few months ago,
Hmm.
going back to your question about women and women's health and women's empowerment,
Hmm.
we actually trained up young community health workers. The girl that I shadowed was only 17 years old, believe it or not.
Wow.
And what she did, again, we work in very rural contexts for the most part, is she would go door to door within these communities, visiting new moms and educating them through a picture book. It was like a flip book of pictures and an
Mm.
audio that she would play about health around raising a newborn. And believe it or not, when I shadowed her on this for this day, one of the women that we visited, she lived in a very, kind of like a clay structure.
Yeah.
There weren't any doors, there weren't any windows, there was no kitchen, there was no running water. She
Hmm.
had 4 children. The baby was only about 5 months old. And the lesson of that time of that visit was about, not giving the baby milk, water, not giving the baby coffee, not giving the baby
Wow.
soda, like these very simple things that when you have no access to internet, there's no access to education, can be life-saving for these children. So a lot of our work is also around maternal health, breastfeeding, nutrition with young children, and we
Mm.
actually train up these young, like I said, community health workers that are employed by us to help spread this and amplify this message to new moms.
Mm. Jan, this has been great having you on today and learning more about Action Against Hunger. I've been looking forward to this interview. I just have to ask, what's next? What's next for you? What's next for the organization?
So, my goal with Action Against Hunger is really to be on calls like this and podcasts like this and amplify the message of what we're doing. People want to do good in the world, and there are so many people that are in need. So it's like sometimes I like to call myself like a philanthropic matchmaker, right?
Yeah.
Whether your passion is about food systems, whether your passion is about clean water, whether it's about women and health, there's so many things that Action Against Hunger is doing that you can,
Mm.
be a part of and get involved with. So what I would say, what I hope is what's next is
Yeah.
getting the message out to more people, whether that be corporations, schools, families. I think back to when I was in my early 20s.
Mhm.
Believe it or not, my mom and I actually funded a well program together in Africa.
Wow.
And to this day, 20 plus years later, I think back to that gift that we gave instead of
Yeah.
exchanging Christmas gifts. And I think this whole community has clean water because of what me and my family did back 20
Amazing.
years ago. So, I would encourage people to, whether it be follow us on social
Mhm.
media, get on our mailing list, reach out to me directly on LinkedIn. And I run a global advisory council. I
Mhm.
run a lot of volunteer initiatives, corporate partnerships. I can put you in touch with, anyone that you might be interested in chatting more
Mm,
about how to get involved and how to give back in a meaningful way. That's what I'm hoping for, in the
yeah.
next chapter is more people feeling empowered to take action, right? It's in our
Mm,
name, Action Against
yeah.
Hunger. Like you said earlier, these issues that we talk about, they can feel daunting, but really they're fixable and they're solvable, and it doesn't take much to fix or solve them. Again, when I was in Nairobi a few weeks ago, many of the people that we worked with, they live on less than $1 a day. So
Wow.
you might think, oh, what's $25 going to do? What's $50 going to do? In the areas that we work, that's transformative. The
Yeah.
average loan in Africa, when we give loans for new business, the average loan is $25.
Mm,
And that transforms a woman and her ability to provide for her family.
mm,
So, sometimes the solution is more simple than we realize. It's just a matter of
mhm.
finding the right organization that you could trust. For Action Against Hunger, 91 cents to the dollar goes to our programs. When
Wow.
I told you I was looking to get into the field of international development, I actually researched what organizations are the most effective and innovative and sustainable. And Action
Mm,
Against Hunger was the one I found that was meeting all of those marks of what I wanted, which is why I'm here.
yeah. Jen, this has been amazing. How do people follow up? How do they connect? How do they learn more? And all those things you were talking about, how, about getting involved.
Yes, absolutely. So, of course, the easiest thing is to go to actionagainsthunger.org
Mhm.
to sign up for our newsletter, to connect with us on LinkedIn, Instagram, Facebook, connect with me. Like I said, I do a lot of the outward outreach. So if you want to have us come and speak at a school, or do a virtual talk for a different organization, those are the types of things that we would love to do to amplify our message. So follow us. Consider getting involved with. A special program that we're doing, like I said, this new initiative around school lunches, something that people are really excited about and feel really good about providing healthy access for kids and provide
Mm.
that education, which is critical for them to have a chance at a successful future.
Wonderful. It's been amazing, Jan. For everybody that's listening, just so you know, we'll definitely put some links in the show notes so that you can connect and get involved. Definitely Action Against Hunger. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. You heard me correct. Each and every day, we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way in your journey as well. So hit that subscribe or follow. And Jan, it's been an absolute pleasure. Can't wait till the next time we can do this.
Thank you so much. Thank you. Thank you.